Okay, thank you, sir. Thank you, Hindi team. Now we are moving to today's English session. Today is our 1965th day of continuous webinar. Before beginning the session, we'll have a silent prayer. Good evening and welcome once again. Today is our 1965th day of continuous webinar. We are conducting this webinar for without any break for last 1965 days. Today's our guest is Dr. KRISHNA PARIKH, is BHMS and Diploma in Naturopathy and Yoga, Associate Professor in the Department of Obstetrics and Gynecology in Sri Mahalakshmi Ji Mahila College of Homeopathy, more than 22 years of experience. She provides comprehensive homeopathic care to women and including pregnancy. And today's our topic is menopause and its homeopathic management. You are welcome, Dr. KRISHNA PARIKH. As she joined, Dr. KRISHNA PARIKH.
No, I don't see her.
Yeah.
Dr. Dhanesh, you can call.
Dr. Dhanesh?
Don't have the number.
Yeah,
yes, sir.
don't
Yes,
have
sir.
the name.
I shall call. I shall call her.
Okay. Dr. KRISHNA, you're welcome. We already introduced you. Okay, you can
thank
start.
you, madam. Actually, there was a problem related with the Zoom application. I was
no
little bit. There
It's
might be some. Yes, madam. Should I start,
Yeah.
madam? Thank you for introducing me.
No, I introduced already.
Okay. Thank you, madam. I'll start. Today's
You
actually
can
good
share
evening. Yes, madam.
Okay. You're welcome. You can start.
Okay, madam. Good evening, everyone. Am I audible clearly?
Yes, audible.
My today's topic is menopause, and related with the menopause, there are some homeopathic management. We all are aware about the menopausal stage, menopausal symptoms, and each and everything regarding the female life. But here I am going to present some brief introduction or the brief regarding the menopause. There might be some queries of the students that what I face in day-to-day life or the day-to-day routine, that regarding the menopausal stage or regarding the menopausal symptoms. I'll start my PPT. Can you see my PPT or not able to see it? Actually, I am little bit confused regarding it.
I can see the PPT. Yeah, I
You
can
can
see, but not. Yeah.
slides.
But,
Can you see the slides?
No, not the slides. I can see only you selected the menopause, but not started sharing the slide.
Actually, I have opened that slide, but little bit.
Yeah. Started.
Started?
The osteoporosis.
Yes.
The osteoporosis.
Okay. So I'll show you first of all the menopausal symptoms. Okay. So these are the menopausal symptoms, as we all know, aware about all these things. The hair loss is there, irritability is there, mood swings are there. First and foremost thing the female is facing about the hot flushes. Hot flushes, as all we know about all these things, anxiety, depression, it is the main symptom regarding the menopause. Dryness, which comes with the eyes and change in the vision, headache and migraine, the female having the symptoms of the soreness or dryness about all the organs, which are very common in the menopause. So in menopause, as we know that what is the menopause? The 45 to 50 years age group, in that the mean age is about the 50 years. In that the female is facing the symptoms that it is not just the stoppage of the menses. It all the depends on the hormonal imbalance in the female body. How the hormonal imbalance at the time of the menarche, uh, as the hormone develops started and producing the endometrial lining and producing the or running the female whole body. As we know that the hormones are the known as the orchestra of our body, they run our body. So at the time of the menarche, all the hormones are established to running a female body. But as soon as the menopause approaches, these hormones started deteriorating, or the hormone is doing the work like that. All the organs or the bones itself, they are starting deteriorating. As we know, it is known as the aging process. So if I am talking about the endocrinology regarding the menopause, that hypothalamo-pituitary ovarian axis, it is known as hypothalamo-pituitary ovarian axis, FSH and LH, the negative feedback effect which produces from the hypothalamo-pituitary, and this FSH, the excess amount of the FSH which produce, and they act on to the ovaries. And now what happened? Okay, ovary is not going to produce any follicle. Ovary is not going to produce any hormones. So the FSH is continuously secreting and secreting from this hypothalamo-pituitary. But on the other hand, the estrogen is not responding. Estrogen is not producing. So FSH is not comes under the control. In normal way, the FSH act onto the ovary. Ovary is going to produce estrogen. Now what estrogen does? Estrogen controls that FSH, and FSH comes into the control level. But in menopause, it doesn't happen. Continuously there is production of the FSH, but on the other hand, there is no production or very less production of the estrogen. So we can term that the female is having the menopause. If we are going for some laboratory procedure or the laboratory findings or some laboratory investigations, what the hormonal studies we are going to do to confirm the female is having menopause, that we are going to do some FSH and LH level into the laboratory. So FSH level is very much high, beyond the normal limit, then we can term the female is having the natural menopause. Okay, then there are some organ changes which takes place. All the female organs have the changes at the time of the menopause, from the vagina to uterus to breast. Even the main impact or the major impact which leads onto the bones of the female body. So bones is having the density, or it is very low density. Okay, some students or some patients, they regularly ask me that if there is no estrogen, then how the female body runs? There is stoppage of the production of estrogen, or there might be some production of the estrogen. So from the ovary, there is very less production of the estrogen after the menopause. But most of the time what happened, the female body having the fat tissues. So androgen which converts the fat into estrogen, and then the female body, it helps in running the female body. Then also it is not that much sufficient enough that it can run the female body in the normal way. So female is facing a problem or issues of the osteoporosis. Okay. If the female is having menopause, then we cannot term that the female is having the menopause till the next 10 years. A female is having menopause in true sense after she has stoppage of menses or after she has some changes in her body after 10 years. It is termed as true menopause. Okay, in this bone, normal bone. So normal bone having the good calcium amount or good bone density. While in osteoporosis, it is it is very much porous space. You can see the difference between the normal bone and the osteoporotic bone. So osteoporosis bone is very porous, and majorly what happened, this bone, which bone is affected mainly? Mainly long bones, as well as this vertebral column is affected. And vertebral column is affected. So what happened if the vertebral column is affected? As the female's age is progressing day by day, so what happened? In a 1 year, she might have lost her height to 2 to 4 mm. Approximately 2 to 4 mm in each year, she is losing her height because of this osteoporotic changes. Now, I'll show you one thing. This. You can see here in first image, that is a normal female or normal curvature of the spine, and in this aging process she have a hump, back hump, because of this curvature of the spine is changed, and this curvature is changed because of the osteoporosis, and this condition is known as the kyphosis of the vertebral column, or you can say the kyphosis. Okay. The next image I'll show you regarding the osteoporotic changes. You can see here normal bone versus the osteoporotic bones. Okay, one more image related with this, that you can see here the normal bone curvature or the spine or the vertebral column and how it progresses to this stage to this stage. Okay, as soon as one more image. Okay, so how we will confirm this? It is known as, this procedure is known as the DEXA. DEXA, that is the dual energy X-ray absorptiometry. On the two beams of the X-ray is passed from the above and from the below. This patient is positioned like this way, and with this DEXA, that is one can come to know about the bone mineral density, the how much the bones is strong enough or how much the she has osteoporotic changes in her bone. This is the one of the investigating procedure. Okay. What are the common risk factors related with the osteoporosis? The non-modifiable, in that the older age, in the female gender is obviously very much important. Menopausal age, or because of the menopause she might have this osteoporotic changes, and it is the major factor for the osteoporosis. Family history, if the person is female is having family history, whether her mother or auntie might have suffering from some osteoporotic changes, she are vulnerable for that thing. Small frame or low body weight, it is also osteoporotic changes. As I told you previously, if deposition of the fat or the fatty tissues in the female body, they convert, the androgen is converted this fat tissues into estrogen, and that estrogen supplies or run the body in a normal way. But in the low body weight or malnourished female, they might have early osteoporotic changes because of there is no fat tissues in her. History of the broken bones or the height loss, it is also have one of the factor which is related with the osteoporotic. Now, modifiable, low levels of the calcium and vitamin D. One can consume the calcium tablets or the vitamin D. Nowadays, the vitamin D is very low in many people, and they have to take the vitamin D supplements. Then reduced intake of the vegetables and fruits, as we all aware about this thing. The food habits have changed, junk food intake has increased, and because of that, the chemicals which are used for this vegetables and fruits, to prevent them some as a pesticides, which can also lead to some risk factor in the body, or adulteration is there into the food, which can also not good for the health. So if you are taking some organic vegetables or fruits in a routinely in day to day life, then you can reduce this changes. Increased intake of caffeine, sodium and protein. Being a homeopath, we generally advise them as your homeopathic medicines are going on, stop drinking coffees, but some are addictive of the coffees. So if they have intake of the caffeine in abundant amount, it can lead to the osteoporotic changes in early life. Then sedentary lifestyle, smoking and increased use of the alcohol, these all are the habits or the risk factors, or these are the factors which we can modify in our day to day life. One more important thing, so if we are going for the DEXA, then we come to the know about the T score. This is the investigating procedure, the how the bone density is there, or bone density is good or bone density is not good. Okay, so if the T score comes into the 0 level, or it is going just to the -1, then we can term it, they have a good bone density, or they might not have chances for few years regarding the osteoporosis. From -1 to -2.5, it is known as the precursor of the osteoporosis, that is known as the osteopenia. So this is the alarming situation, low bone density or the osteopenia, that is the alarming situation for a individual one or for the patient. If they take care from this stage, so this we can avoid the osteoporosis or the porous bone, or we can avoid the fracture like condition in the future. But if this T score is below, or it goes just up to the -4, then the condition is not good, it is worsen, the person is having the osteoporotic changes, so they require some calcium supplement, or they require some other medications regarding this, or they require some other management. Okay, now apart from bone, menopause have also impact onto the heart. Because of this loss of the nitric oxide, generally what happened, because of this nitric oxide in the routine life which secreted and which not allow to deposit the cholesterol into the arteries. Now there is loss of the nitric oxide, so which can lead to there is deposition of the cholesterol or erythematous plaque into the arteries, and which can lead to the increased risk of the heart attacks or increased risk of the heart diseases. So what are the factors for this thing related with the heart disease? So one and foremost factor, that is the low estrogen level. Another factor, that is the weight gain, as lower weight is not good, so more weight is also not advisable. Obesity is not advisable. More weight or the obesity, which can lead to some other conditions or the other factors or other clinical conditions into the body. Smoking, alcohol, family history, and if a lady is having the HRT, that is the hormonal replacement therapies, she is on the hormonal replacement therapy, then also she has increased the risk of the heart disease or the heart attacks. Okay. Some other condition or some other the main objective symptoms, some other symptoms regarding this, the psychological symptoms, we can say. What are the psychological symptoms regarding the menopause? These are the depression or the aggressiveness, sudden mood swings, there is difficulty in concentration, there is lack of motivation, anxiety, fatigue, decreased interest in the sex. All these are the some psychological symptoms related with the menopause. But in such symptoms, our medicine works best along with the good counseling. So lady in this stage, she required counseling. She required, she has to engage herself in some work or in some hobbies in this period. So she might not have the symptoms like depression, she might not have the symptoms like mood swing or aggressiveness or some difficulty in concentration or the symptoms like anxiety. Because I have seen in many patients anxiety, depression and aggressiveness in such phase of the menopause. So we can avoid by engaging them in their hobbies. Advise them to engage themselves. One more important symptom, this, that is the vaginal dryness, vaginal atrophy. All the organs have changes at the time of the menopause. Vagina has changes. You can see here the normal thickening or lining of the vagina and thin and dry lining of the vagina after the menopause because of the decreased blood flow, or you can say there is lack of estrogen. This is the main symptom or main symptom nahi, but main cause or main factor that there is no estrogen or very low amount of estrogen which can lead to this vaginal dryness. In these cases, in such cases, our medicine also works to some extent. We cannot say to the patient that it is the our medicine also works permanently, but there is some cases we can prevent this or we can give cure to some extent in this vaginal dryness. Uterus also gets atrophied, fallopian tubes or the cilia into the fallopian tubes, they also gets atrophied. Now the cilia will also not work into the fallopian tube. Ovaries, as we know, the uh, whole thing is because of ovaries, it also gets shrink, or there are some there is follicles into the ovaries, they also get shrink, or there is no production of the follicles from the ovaries. Now in this image, next image, we can see the difference. One side, half of the uterus which is very much good or lining is very good. On the other side, there is vaginal atrophy as well as there are uterine atrophy also. Uterus also becomes smaller in size. Now because of the function is also not there into the uterus. Now, so is vaginal dryness is very important or very pronounced symptom. Symptoms of menopausal mood swing, as we discussed. This is a very good image according to me. These are the objective symptoms. That is the purse string mouth and crow fits eyes. So this is a symptom regarding the skin atrophy or regarding the ages, or you can say regarding the menopause. If after 10 years of the menopause, you are the lady is termed that she is having a true menopause, then you can see such objective symptoms because there is no estrogen now. So skin also losing their elasticity and because of that there is purse string mouth as well as eyes having the claw fit wrinkles regard into the eye region. Okay, there are some medications related with this. Stress management technique. We can advise patient regarding the meditation or regarding doing some yogas. We can also advise them to do exercise. We can advise them that go for the walk regularly every day. Eat foods high in vitamins, minerals, which provide them good nutrition. Some medication or some supplements should be taken, but not much hard medications. Avoid trigger foods, like one can avoid that junk food, one can avoid foods which contain actually maida or the very white flour. One should avoid that kind of the food. A person or female should having a proper routine. She should have food at the same time, or she should have a proper sleep for at least 8 hours per day. And there is some essential oils which gives or boost her mood, so we can avoid the mood swings. Okay, there are some treatments or the medications. First and foremost, that is the hormonal replacement therapy. Now, who will get this hormonal replacement therapy? A female is having pronounced symptoms of the menopause. That female only will get this hormonal replacement therapy. Pronounced symptoms, if she is having the pronounced symptoms like she is having osteoporosis, or she is having some more psychological symptoms, or she has lost her bone density, she might have more risk regarding the heart disease. But HRT will lead to the heart disease, so we cannot consider a heart disease patient for the HRT. But pronounced symptoms, she is having severe vaginal dryness, and because of that it is unbearable for that, because of some burning and itching constantly. So such females might take the HRT. So vaginal, what are the types of the HRTs? So vaginal estrogen lubricants or moisturizers can be advisable if she is having severe dryness. So estrogen containing ointments, estradiol, can be prescribed to the patient, but it should not be prescribed for more than 3 months. They also don't advise for this thing. Then some oral subsequent combined estrogen and progesterone pills. It is required if a person is having severe symptoms or had gone for some hysterectomy like operation, and if a person has removed the ovaries also, then they are prescribed estrogen and progesterone containing pills. Then some subdermal patches which are also available in the market. Those who don't want to take some oral medications, those is transdermal or subdermal patches, they kept, and that should be changed after 15 days or after, it depends how that patch works. Then oral continuous combined pills which are given, or patch continuous, some patch which are kept transdermally onto the lower abdominal region or the pelvic region, which continuously secrete the estrogen, and because of the some estrogen deficiency we can avoid that thing. And in non-hormonal treatment, clonidine, venlafaxine or gabapentin, it can also be applied, it can also be given as a part of therapy. Now, how much it should be continued? As soon as one gets the result regarding the HRT, it should be stopped. Not more than 1 year it is prescribed. But if the symptoms are there, then it should be prescribed under the observation of the gynecologist. If the HRT is continuous, then her BP should be monitored regularly. Breast examination should be carried out regularly. So one can come to know that if there is any tumor like condition into the breast or not, or patient is completely normal, because there are chances because of excess of estrogen she might have she is at the risk of some tumorous condition over the breast region. Okay, then one more important point, some factors which are responsible for the premature menopause. Premature menopause, that is below the age of the 40. If a lady is having the permanent cessation of the menses, then we can term it as premature menopause. In that, which are the factors? If the lady is having habit of smoking, she might have some autoimmune disease and she is continuously on some steroid therapy, then she might have premature menopause, or she is having some disease like HIV, AIDS or mumps. Then also, if a family history, mother maternal side auntie or paternal side auntie, they might have some history regarding early menopause, then also she might have premature menopause. Chemotherapy and hysterectomy. Hysterectomy, if only the uterus is removed, then you cannot term she is having the menopause. But if she is having removal of the uterus along with the ovaries, then that is total hysterectomy. Then you can term that lady is having premature menopausal symptoms. If a lady is suffering from any kind of NECA, then the chemotherapy or radiation therapy, which can lead to the premature menopause. I want to share one important point regarding the radiotherapy or the radiation. If a lady is having radiation therapy, for example, age of the lady is around 35, between 35 to 40 years. Till now, she is regularly menstruating. But suddenly what happened? She is diagnosed with some CA. She has to undergo for some radiation therapy. At that time, for a temporary basis, her menses get stopped because of some radiation. But it is not the permanent menopause. After, if the therapy gets over, and after few years, you can say within after 2 or 3 years, she might resume back with her normal menses. So it is just a temporary cessation of the menses because of some radiation therapy, and it is known as induced menopause, or you can say not the permanent menopause. She might resume her menses for few years more. Okay, now what is known as the induced menopause? Because of some surgical treatment like bilateral oophorectomy, as I told you, total hysterectomy, medications like chemotherapy or radiotherapy, which is known as the induced menopause. But it may be reversed in some cases. Okay. So these are the you can say these are the cases, or these are the main related with the menopause, that what are the symptoms and what is the management part. Now I want to tell something regarding our medications or our drugs related to the menopause, which actually works good at the time of the menopause. So I have some medicines that mm, in
Doctor,
that I have
screen sharing.
yes, madam. Yes, madam. Are you saying
Okay,
something?
okay. Yeah, have you stopped the screen sharing?
Yes, madam, because this I want to just discuss.
Okay.
So there are some medicines which are like lachesis, as we know, calcarea carb, belladonna is there, one of the good remedy. Nux moscata is there. Sepia, yes, sepia is one of the best remedy related with the menopause. Then we have other rare remedies like amyl nitrosum or mancinella, or one nosode, that is the uforinum, which also acts good if the ovaries are removed. Then zincum valerianum is there, or graphitis. Gelsemium is also there. So these medicines works accordingly symptom totality or the symptomatology of the patient. From this, I have a good results with the lachesis or calcarea carb, or you can say sepia. Sepia is one of the best remedy for the vaginal dryness. Natramur is also there for the vaginal dryness. Then lachesis, as we know all the symptoms. Then this slips into she's aggravation into slips, or the dark red blood, which is also very good. I want to share one or two cases with you that I had a patient of vaginal dryness. That lady had no idea that she has vaginal dryness. So constantly she was telling, or she was giving the symptoms that I have a itching into the lower part. I have a burning into the lower part. There is a burning when while I pass the urine, or after urination I had a severe burning. Though her report had good amount of the pus cells into the urine routine micro had in that report there are many pus cells. But then also I advised her for the gynecological checkup, and the gynecologist advised her that vaginal cream, estradiol containing cream. But he also tell her that no, don't use this cream more than 3 months. You should discontinue, not continuous using of this cream. At that time I came to know that lady, age of that lady is about 70 years, and she had complaints since many years after the menopause. But then I came to know, then I came to realize that she is having this complaint because of vaginal dryness. She is having complaint because of this lacking of estrogen, and just after the menopause I tried many medicines. I tried because of her UTI report. I gave her Cantharis. Uh, but each and every medicines, then I tried sepia also. I tried even this creosote also, because the creosote has a specific indication that it is useful in vaginal dryness in menopausal stage or in climacteric period. So creosote gave her relief, but it was not complete relief. It was not complete cure. It was just relief. I also gave severe burning was there. Burning was so much so. 3 plus 4 plus burning is there. So one dose of sulfur also I gave her. Single dose. All these medications, it gave her temporary relief, but not the permanent solution. So she keep continuing taking the medicines, or now she has moved some uh, home remedies like but she is taking creosote, gave her good relief or the good result. Then one more case which I had just before 15-20 years, just I passed at the time my internship, that a lady had depression, and that depression was since 6 or 7 months at that time, and she was not having good enough to do work. She doesn't have wants to do any kind of any work. Then I took her symptoms or the whole history along with her past history or her past life, and that time, because of some history taking, I gave her calcarea cup, and that calcarea cup worked miraculously, and she came out of her depression. I keep continuing the medication at least for 6 months. So she feels very relief and she came out from the depression totally. It was a good results from the calcarea cup. So I remember these two cases when I get actually success or actually I got the good results. With this, I conclude my presentation. Anything else you would love to ask or want to discuss something? Anybody?
Thank you so much, Dr. Krishna. It was a very important topic. At least every woman should know what is happening in the body. So I think you are giving awareness about menopause to everyone. That's a great work, because many of them are not aware about the changes what they have, and not aware about what to do. And even many are hiding their symptoms and they are suppressing their emotions even. So that will blast into another problem. You are doing a great thing. So I'm appreciating you for that. And it is a nice presentation even. You structured it very well. All the slides are giving good awareness about menopause. Anyway, the participants, if you have any queries or any questions, you can ask to Dr. Krishna. She's ready to answer your questions. Please hand raise and you can, I will unmute you and you can ask. Please come forward. Dr. Ramadevi Ambadi, we have two homeopathic gynecologist here, Dr. Ramadevi Ambadi and Dr. Shanda Chandran. They were in the project of Janani here. They have treated 2,000 infertility cases in Kerala. Dr. Ramadevi Ambadi, Dr. Shanda Chandran, please come forward.
I'm too small in front of these madams. I apologize if I have done any mistake.
No, Dr. Ramadevi Ambadi, Dr. Shanda Chandran, please. You have a question here, Dr. Sheila. Ma'am, which potency of creosote and calcarea car?
Madam, I gave creosote in 200. It is just for 1 week or so, once a day, not more than that. And then I stop, and then I repeat after some time, not give continuously. While calcarea carb, I was giving 3 doses per week, and I repeated that medication after. Actually, I was showing how it works or how long it works. Most probably, what I did, I repeat initially in 15 days, and then after 15 days, I repeated twice or thrice, and then after I repeated once a month, 3 doses. Likewise, I gave her cure.
ഹലോ കേൾക്കാമോ? Can you
Please.
hear me?
Yes, madam.
Dr. Ramadevi.
Sorry, Ajni, I was not
Namaste,
able
madam.
to unmute it. Namaste, namaste, Veda. I could not open this. I could not unmute. That's why it was delayed.
Tamara.
It was very
It's
nice
okay. It's
presentation.
okay, madam. You can talk.
It was very nice presentation. Very good. Keep it up. And
Thank you, madam.
nicely you have narrated everything. For menopausal complaints, we will give. You told creosote, no?
Yes,
We
madam.
used to give creosote varnam plus casio sapporo tincture.
Okay.
Menopausal bleeding.
Okay. Surely I'll remember this.
Very, very nice. We can at snapshot we can use. Very
Okay,
nice
madam.
medicines.
Okay, madam.
You have explained very nicely. Keep it up. Come again. Thank you.
Thank you, madam. Thank you.
Thank you, Dr. Ramadevi Ambadi. Dr. Shanta Chandan, you also have to say something about Dr. Krishna's class. She has taken it as a mission, even not only for teaching. And Dr. Victor, you can talk now, please.
Ma'am, which medicine you suggest for premature menopause?
Premature menopause, I actually take the whole case on the basis of case taking and mentals. Then also, I came to conclusion about the medicines about the premature menopause. But if you go for some rare medicine, then uforinum works very good. If there is bilateral oophorectomy is there and premature menopause because of that, so we can give uforinum, or patient is having gone through some radiation therapy or chemotherapy, then the medicine will be changed.
Okay, ma'am. Thank you.
Okay, ma'am.
We have 8 more minutes. I think if they don't have any question, means you can even share one more case.
One more case that
You mentioned about sepia. You have result from sepia.
yes, sepia. I prescribed sepia, but not in menopause. I prescribed sepia in post delivery hair loss.
Okay.
And sepia gave me very good results in in puparium period. That female had a baby of 3 months old, and she came with the complaints of the severe hair loss after her delivery. At that time, because of her mental state is also like indifferent, and she was not having interest because of her routine life or in routine schedule. She was fed up with all those things after post delivery, or you can say post delivery depression might is also there, little bit amount. At that time I prescribed sepia 30 once a day for 1 week or 10 days continuously for 1 week, and then I stopped it. And then after I called her, and then I kept her on the placebo and told her to come back after 1 month or 15 days to I feel I should wait and watch how the sepia works. So it gave me actually very good results. What happened? Hair loss was stopped, and she was also feeling better by her nature, in her nature or in her irritation or aggressiveness. So it gave me very good result in that condition.
And you mentioned about the hair loss after the delivery. So for the hair loss of menopause, are you treating the menopause as, or because all the patients are complaining about the hair loss, not
Well,
the,
hair loss, as we all know, hair loss has so many reasons, so
yeah.
many causes
But
regarding the hair
even
loss.
menopausal other symptoms, they are not bothering about the other symptoms.
Yes, yes,
They are
baldness.
bothering hair loss. Then
Yes.
everyone is,
Whether it is female or male, they have major issues regarding the hair loss or the baldness. They may get early baldness.
yeah.
So, yes,
Even though menopause also, they are not bothering about the other symptoms and the difficulties and mental symptoms. They neglect, but they keep on telling about the hair loss.
but in that hair loss, Arnica Q, Jaborandi Q mixture, local application, it gave me very good results. So I
With oil, right?
generally, in my practice, what I do, means I find out the cause first. Okay, what is
Mhm.
the cause of the disease, and then I started the case taking on that basis, and then I come to the conclusion that what is the individualization or the individual remedy for that particular individual. So in that, actually in market, they demand the hair oil, they demand some ointments like other pathies. So I gave them this combination of this arnica and jaborandi. So next time they demand, नहीं आपने जो application दिया था वो you gave that one. It gives us very good result. Otherwise, what the oral pills also works, but they feel कि नहीं वो लगाया, so we feel better.
after after that, or apply after applying that oil, that became okay.
हाँ हाँ मतलब उससे वो कम हो गया या बंद हो गया बस.
Yeah,
That is the mindset.
yeah. Because for long years they are seeing the same thing, no, applying,
Yes.
and
Hair
it,
loss complaint is very. There are so many causes, so many causes. But they don't understand about that thing. There are other causes, but nahi. Hair loss, you give us.
yeah. Anyway, it was nice presentation, and your
Thank you so much for including me.
you come again with the other topic, or the same topic even that, because we have to learn more from the same topic. Anyway, I think we have 3 more minutes. Anyone, if anyone have question, means you can ask, please. Otherwise, we'll hand over the session to Malayalam team.